Hello YouTube, it's me again, VSG Dawn. I was just curious and I had a question. I wanted to post it or send it out there so anyone who has an answer and is willing to share can just list it in the comments below, because I know some people may be interested. I know I was interested, and it's kind of a lot of maintenance to answer all the comments on videos. I can imagine. I don't have that many followers at this point, but I'm sure it has to be very difficult, and people may not always respond to your comment or question that you put in the comments. So this video is entitled, "What is your bougie size?" That's spelled B-O-U-G-I-E. And the bougie is the size of the plastic tube that the surgeon or anesthesiologist will put into your stomach while they are doing the gastric sleeve surgery, and they will use that as a base or a marker to actually do the staples that will outline your new stomach. The bougie sizes range anywhere from 32 FF, that's called abbreviated for French, 32 French. It comes from, I guess, a French-based word, all the way up to I believe 60 FF or 60 French. Now, when I first asked my surgeon when he did my endoscopy what size bougie he was going to use, because I have been researching like crazy on this matter and subject, he told me he usually uses a 40 bougie. And that concerned me a little, because I know the minimal is a 32, and they find people who get a 32 size bougie have a lot of problems with reflux, and they have striction, meaning that it tightens where nothing can get through at all, which causes major problems, and it has to be opened or stretched or widened. I'm not sure how they do it, but a 32 is way too small according to my research, and a 36 was normal, but he said he usually uses a 40. I was worried about that because I know me, and I can consume a lot of food in one sitting, and I thought a 40 would be too big for me. I've seen videos where they measure the sizes, or they put the examples to a skinny big pen as 32, and then one of the fatter pens with the medium point as a 36, and up to the 60, which was a highlighter, a neon highlighter, that type of width. And I'm just curious to know what size bougie you had for your gastric sleeve surgery, to help myself and to help others in the future that may be thinking about gastric sleeve surgery, and to ask their surgeon what size bougie they use. And I asked the surgeon before he put me under for my endoscopy what size bougie he was going to use, and he told me a 40. And I told him I was concerned because I think I have a larger than normal size stomach, because I can hold massive amounts of food, and I only know that from putting it to the test. And he told me after I woke up that no, my stomach was normal and everything was fine. But on last Wednesday, when I went to my last pre-op session or appointment before my surgery that's upcoming August 9th, 2012, he told me that he was going to use a 36 bougie. He found that the 36 bougie has the most success with the least amount of acid reflux, because that is a major problem when your bougie is too small, and for gastric sleeve surgery altogether. So if you have a problem with reflux already, gastric sleeve surgery may not be for you, because you are going to most likely have issues with your acid reflux. You're making a smaller stomach, they're pulling the rest out. Your food is going to sit right there at the bottom of your stomach leading up to your esophagus. So if you already have an issue with the acid and the reflux, gastric sleeve might not be for you. I haven't had an issue with acid reflux really since after my pregnancy. Usually within 2 to 3 months after pregnancy it goes away, but during pregnancy it's a killer. So he told me he was going to use a 36. And that just made me question, because I remember asking him specifically, the only question I asked him before he put me under on the endoscopy was, what size bougie do you use? And I wasn't sure if it was pronounced bougie or boogie, and he found that very funny that I called it a boogie, and he told me 40. Then the last appointment he told me it's a 36. So that leads me to believe my stomach is larger than normal or regular. And if you haven't watched Dr. Alcevis, I can't remember his name, but he does a lot of videos on bariatric surgery, and he's in Mexico. he says the normal size he uses is a 32, which I think is kind of small. But he gives you all the details about the bougie. He gives you examples. He shows you an actual surgery when he's using the bougie. So a 36 I'm good with, I like, but that leads me to believe my stomach is larger than normal. So I'm just asking you, as a weight loss surgery community, if you do know, what size bougie did you have? And it may help others in the future. I know I watch many people's videos for before surgery, during, after. I hate to say it, but when they fall off of and don't make any more videos, I'm thinking their weight loss has stalled. They're not losing any more weight, or they're gaining weight. And I am wrong to assume that, but that is what I do assume. Or they're just enjoying life and they no longer have a need or desire to post on YouTube. But I just want to know if people with bigger bougie sizes tend to hold more food and gain the weight, or start to regain or stop losing quicker than people who have a smaller bougie size. So I would like to know, what is your bougie size, if you know. All right, you can post the comments below. I'm sure people will be looking at this and benefiting for their own journeys in the future for a long time. All right, talk to you later. VSG Dawn.